Thank you. It's a great honor for me to be here. I want to thank Peretz Levy, the president, for this crazy idea of asking a storyteller to speak to real experts on the future of health. But I have to say at the beginning that it's always an honor to be at the Technion because we consider the Technion to be one of the key founding institutions of Startup Nation. And of course, MIT was mentioned before, but here at the Technion, maybe we should call MIT the Technion of the United States. So actually, I'd like to key off something that Professor Ciechanover said. I actually agree with his optimism, and in particular, what he said about that maybe the key will be when we're able to detect individual cancer cells going around our bodies at a very early stage. So that's kind of what I want to talk about is early stage detection and how critical that is. But I want to start with something basic about the things that are killing us right now. This is a chart from the NHS, the National Health Services of the UK, visually showing us what the leading causes of death, of premature death, are. As you can see, the biggest is heart, next is cancer, then respiratory, then nervous, then digestive disorders. And these five are responsible for over 80% of the premature deaths, which is defined as death before 75 years old. And about 1/3 of people in England and the UK die prematurely according to this definition. So what can we do about this? So we're going to start with a basic idea of how health works today so we can figure out what a new paradigm might be. This is how every condition starts. It starts somewhere at zero. We don't have the condition at all, any of these five killers, and then it progresses along this line until perhaps it gets to 100% and becomes a killer. Now, what's the problem? How do we do health today? Well, it starts really from when we feel bad and when we go to the doctor. And that point in the continuum could be anywhere, but often it's towards the end. Often we feel bad, we go to the doctor, and the doctor does lots of big tests on us and then says, sorry, you've got stage 3 or stage 4 cancer, or any other of these conditions at an advanced stage. And then what happens is our health system kicks in. Now, I'm calling this the heroic paradigm of medicine because we're dealing with health at the hard part. We use all these heroic measures, and we all know about the amazing treatments that are coming online with chemotherapy, with radiation. It seems like there are new treatments all the time, new insight into how cancer works. But in terms of treatment, our starting point is at the end often. And we need these heroic measures to try to solve the problem, but often we fail. And you know, one of the most heartbreaking aspects of all this is that often these heroic measures just buy us a little bit of time. And this was said earlier. And this is a huge problem. So we do all these heroic measures, and we still have premature death. So I would suggest that we have to move to a new paradigm of health. And that is to do health in a different place on the spectrum, to do early detection, to focus on how can we do health at the beginning, not at the end. How can we find the problem? Let's say with cancer, how can we find the tumor when it's 1/2 centimeter and it hasn't spread to the rest of the body, at which point it's relatively easy for us to deal with the problem and maybe, as Professor Ciechanover said, to turn it into, at worst, a chronic problem, but maybe even better than that. We can really solve it and not just buy a few years of life. So what's missing? How can we get to this magical point, this dreamlike point in medicine where we're actually dealing with the problem very early on where it's much easier? Well, the first thing we're missing, of course, is biomarkers. In cancer in particular, we're missing tons of biomarkers. There's actually probably very few cancers that we have a good biomarker to look for that would tell us very early on that the cancer exists. And we are discovering new biomarkers slowly, but we're missing a lot of them, not just for cancer, but lots of other things. And then we have another problem. Let's say we've discovered this amazing biomarker that tells us the cancer is there at a very early stage. Our next problem is we have no idea the biomarker is there because we don't take blood tests every week or every month or even every year for many people. So we need something else, and that's sensors. We need actually real-time sensors on our body or inside our body that are telling us when these biomarkers exist, not just for cancer, but for all these 5 big things that kill us. But there's also a missing piece between the sensors and the biomarkers. And we have this sort of catch-22. We don't have the biomarkers, we don't have the sensors. How can we get this off the ground? And the key thing is to realize that the third component is data. And actually, I was very excited to hear from Paris that Technion is going to form a new center of data science. I think that's a critical component of all this. And basically, this is what connects sensors and biomarkers, because when we have sensors that are producing continuous data, we will discover biomarkers. We will discover a lot of those missing biomarkers. And I know this is not very intuitive, this whole idea of data science, of big data that people talk about, doesn't necessarily make sense. So I want to give 2 quick examples. One that actually doesn't include sensors at all, but it describes how big data work. And the second that does include sensors that's closer to what we're talking about. The first is from Google. Google came up with this thing called Google Flu Trends. And of course, we start with the fact that flu kills about 36,000 people every year in the United States. It's an enormous problem. The CDC says that if we could detect flu earlier, we could do a much better job of treating it, we could reduce the number of cases. And then the New York Times reported that Google was able, by just looking at the search terms, by doing an analysis of millions of searches from millions of people, was able to beat the gold standard of detection of flu, which is the CDC, the Center for Disease Control, goes around, talks to hospitals, talks to doctors, collects all this data, and is able to identify a flu epidemic. And Google was able to identify the same epidemic 2 weeks before the CDC, just using search terms. How did they do that? Well, basically what they did is what's called big data. They took enormous amounts of data and they looked at how it might correlate with flu. And they found that 45 search terms, maybe some of them obvious, like searching for cough or Advil or something like that, was correlated with flu, but maybe some that are less obvious. And it doesn't matter. They're looking through all their data and they see what's correlated with flu, and it pops right out. And it turned out to be better than clinical data. They didn't talk to a single doctor, a single hospital. And that's pretty amazing that there could be a serious health outcome by just searching among searches. And I want to give the second example, which is more related to this concept, which is from a place called the Hospital for Sick Children in Toronto, and particularly their NICU, which stands for Neonatal Intensive Care Unit. Of course, many hospitals have this kind of unit to deal with, to take care of premature babies. And as we know, these units where the premature babies are in these incubators, they're all hooked up to monitors. They're measuring heart rate and temperature and blood oxygen and many different things continuously. They've been doing this for years. But historically, none of this data has been collected. You know, the alarms go off when you're supposed to do something about the heart monitor is telling you there's a problem, and the doctors and the nurses go around with their charts and they write things off, they check things off. But nobody knew or thought to collect the data, not just for each baby, but all the babies over time, and see if anything popped out. And then someone at Toronto in this hospital decided to do that. And they were particularly interested in finding an answer to the problem of infection, because infection kills about 5% of these premature babies. And they had trouble finding these infections except at the last minute when it was hard to do anything. So anything that would give them just a little bit of warning was tremendously valuable. So they looked through the data, and sure enough, they found that a more stable heart rate, less variability in the heart rate, was correlated with infection. But it came, this kind of sign, this biomarker, came 24 hours before any sign of infection that they knew about. So they were suddenly able to treat infection earlier and save some lives. And this is a perfect example how the combination of sensors and data leads to a biomarker. And this is the kind of cycle we need to build. Now, another part of this problem here, part of the solution, I should say, is sensors. And you know, anyone who's watching this field notices that new sensors are coming out almost every day. And then I've just almost randomly picked 3 of these. This is, the first one is a Band-Aid sized device. You stick it somewhere on your body. It can continuously monitor heart rate, temperature, blood oxygen, respiration, movement. And this item is actually exists, is working on people right now. The next one is a glucose monitor, which uses a tiny wire, about 2 centimeters, the width of a human hair, that goes under the skin, connects with any kind of external monitor, and measures blood glucose. So that, imagine that same kind of technique could be used to measure proteins, to measure all kinds of things relevant to cancer. And the third is an implant that has a much more sophisticated lab on a chip, which has been proven in mice, but of course will take a while, but it gives you an idea, you know, what's coming up. So what I'm saying is that if we have sensors, that will produce the data, that will help us discover the biomarkers, and we'll have built a virtuous cycle of health that doesn't exist. Once we build this kind of cycle, it will get better and better. But we haven't started. It's not there yet. We're not on this cycle of improvement. And so the urgent task, it seems to me, for dealing with all of these big killers, including cancer, is to build this kind of cycle. So if we do, we will be able to move to this magic place where we're able to detect a lot of things much earlier. And just to finish with this, let's imagine that it's 10 years from now, and we're meeting again in this room. I think I can pretty much guarantee that all of us will be wearing sensors, or will have sensors inside our bodies. And just as this seems strange right now, if we take ourselves to 2026, and when we're looking back at 2016, we're going to look back at ourselves now and we're going to say, how did we live like that? How did we live without any idea of what's going on in our bodies? And we're going to look back at this time kind of like we looked back 10 years ago when we didn't have smartphones. We can't even remember what it was like not to have a smartphone or how we lived without them. But we did. So 10 years from now, we're going to look back at this time and we're going to think, gosh, that was really primitive. That was really reckless. How did we live like that? It was as if we're looking back now to an era before antibiotics, when people could die of a scratch, you know, from infection. It will seem that reckless, that horrible, that primitive to look back at this time right now. And this new paradigm, I think it's less than 10 years, but certainly 10 years from now, we'll be in this new world, I hope, of sensors, of biomarkers, of data, that will bring us to a new world of early detection that allows us to prevent millions and millions of premature deaths. Thank you.